There we go. All right. Looks like we're live.
All right. Hi, everybody. I'm Dr. Buisson from Helping Hands Pet Hospice, and we're doing our Facebook Live this month on cat arthritis. We've had some questions. We had some for the last Facebook Live, which we couldn't get to because we were doing doggy dementia. So we're going to talk about cat arthritis today, and it's going to probably be a little bit shorter than usual just because we have an unexpected appliance delivery arriving, and I have to go meet it, and I just found out about it like an hour ago. So we're going to try to get this done and get me there in time. So we'll see what happens. So we're going to talk about the feline friends getting older and having more problems with walking and jumping, and some misconceptions that people have about arthritis, especially in evaluating pain in cats. We let cats get way more painful than we should. And that's because cats aren't great at communicating pain. Sometimes it comes across as grumpiness. Sometimes it's just, in fact, most of the time, it's just a change in behavior. So we want to talk about how our feline friends show us that they're uncomfortable and then what we can do about it. So Cheyenne's got our questions lined up, and here we go. All right, first question, how do I know if my cat has arthritis? She doesn't cry. And I always say this, if I had a nickel for every time somebody told me that their pet's not crying so they're not in pain, I would be able to retire right now. Pets don't cry generally when they're in pain unless it's what we call acute pain. So acute pain is like you break your leg. That is instant, severe pain. Arthritis pain, and it's amazing because people don't generally cry when they have arthritis pain. You know, you might rub your hands or rub your sore knee or put your hands in your back and lean back in the morning or be real stiff when you walk. But most of the time, unless you bang your arthritic elbow on a door jamb, which I did yesterday, you don't tend to cry about it because it's not an acute pain, it's chronic pain. So it's more of a low grade or even high grade, but achy chronic pain. And so if we wait for our pets to cry, we're going to miss all of the pain that they're going through and potentially not really intervene until it's too late to make any reversals. And it may even be too late to help them at all. And so, you know, one of the things that really breaks my heart is seeing a patient that we're euthanizing because of arthritis that has never seen a pain medicine or a joint supplement or anything, because their owners were waiting for them to cry. And that's not anyone's fault. It's just that animals don't communicate the same way that we do. So we need to really make sure that we're watching them for signs instead of waiting for them to tell us, because they tend not to tell us. So what the things that I look for, and this is the question that when I was in feline practice, I would ask every client is your kitty still jumping? Because to me, that's the first thing I usually see with arthritis is that they either jump less or they jump less high. So it used to be they jumped on top of the refrigerator. Now they don't jump up there anymore. Well, it's probably not because your refrigerator is less interesting than it was, or it's less of a cool spot to view the rest of the house. It's because they're having trouble getting up there. And so if they were jumping from the floor to the top of the fridge, and now they jump to maybe a chair and then the counter and then the top of the fridge, that's a sign that they just don't have the confidence to jump straight up. Sometimes blindness can affect that too, if they don't feel confident or if they've jumped that high and fallen. That will keep them from doing that. But if they're jumping less or less high, that is a big sign. Also, you know, just getting up slowly. You know, if they look like a little old person getting out of bed, then they're probably a little old cat getting out of bed. And cats can have arthritis at a very young age. They don't necessarily start when they're very old. And by the age of 12, over 90% of cats have arthritis in at least one joint. And sometimes we can't even see it on x-ray. But if we manipulate that joint, we can tell that they tense, they protect it. They may hiss or claw or try to bite us if we manipulate that joint. Now, I don't want you to go manipulate your cat's joints because odds are you're going to get bitten even if they're not arthritic, because that's not something they really particularly want you to do. So we want to observe their behavior. Are they getting up slowly? Are they going down into their bed slowly? Climbing stairs, are they reluctant? Do they sit at the base of a chair and stare at it for a little while before they jump up, as if they're trying to gauge whether it's worthwhile to jump up on that chair? So hesitation jumping is a really important thing too, because sometimes they still make the big jump, but they have to think about it for a while before they do it. Missing their target, falling. So if they go to jump up on the counter and the push that they need to make to get up there suddenly hurts and they pull back a little, sometimes they'll hit that counter and fall off. So that's one of the things that we look for too. Grooming over painful areas. So if you see them all of a sudden for no reason and they're on good flea control, we're not having any problems with allergies, but they're grooming that wrist area of their arm, or they're grooming over their hip, or they're grooming over their back. Those are things to be investigated. We need to figure out, cats don't just pull their hair out for no reason. So we need to investigate why they're suddenly changing that behavior, because that's how they communicate with us. They do things a little differently than they used to. If they're getting grumpier with the kids or with the other cats, if your young cat jumps on them and instead of getting a big romp around the house, they get hissed at and swatted or screamed at, that's a sign that maybe that kitty's not feeling so well. And we need to look into why they've suddenly decided that they don't want to play with their friend anymore. Moving slowly, not moving as much. So if you're like, wow, he's been sleeping in the same spot all day. And yes, I know cats sleep all day, but if normally at 6 p.m. when you're in the kitchen, they go and come into the kitchen and see what they can beg from you, and now they're just staying in their bed, that's something that needs to be investigated. Also, if you pet them, like for instance, if you pet them from their head down their back and their skin twitches and jumps, that's a sign that they're having discomfort along their back. Their skin gets sensitive. And as pain happens, they get more and more sensitive, to the point that what used to be, a deep pain that only if you really squeezed hard it would hurt, now they hurt like when you have the flu and your skin hurts. And so you might give them a light touch along their back and they ripple or they hiss or they tense up. Or they duck their back down so that you can't touch. If you used to, smack them on their butt and they used to stick their tail up in the air and tighten their legs and really like it, and now you smack their butt and it drops down, that's another sign that they're having arthritis. Okay, next question, ma'am. Is it normal for my cat to stop getting on the furniture? No, it's not. It is not normal for your cat to stop doing anything that they normally do. And people will say, oh, he's just getting old. Yes and no. Cats are going to try to maintain what they normally do unless there is a good enough reason for them not to. So they have to be hurting badly enough to not want to get on the furniture. And I've seen cats that are riddled with arthritis that are still jumping. So it's not 100%. But if you're noticing like that you can feel their bones more, that's a sign that they're losing muscles, and they usually lose muscles because they're not using their muscles as much as they used to. And keeping those muscles strong is important. It's just like elderly people. Now, our cats don't tend to fall as much, but that's the reason why we start seeing them not wanting to do things, because they lose that muscle and then they can't control their limbs as well. Wobbliness in the rear end, if they have a tendency for their rear end to come out from under them, that's another sign that something is wrong. Okay, next question. Why does my cat's arthritis cause her coat to be a mess? Because it hurts to do yoga when you have arthritis. So, I'm in my 40s now, and I don't like to bend over to tie my shoes all the time because sometimes my back hurts. So I will use slip-on shoes instead. So your cat, they have to groom, and grooming requires, you've seen the acrobatics cats do, and sometimes it's super embarrassing when they're, licking their private parts with their foot up in the air. But a difference in grooming, cats like to be neat and clean. If their fur is suddenly oily or real dry or kind of standing up, we call it a rough coat, when they look like a Halloween cat all the time because their fur isn't laying flat. Those are all signs that something's uncomfortable. It can also be if they have a digestive problem, licking and swallowing all that hair when you're nauseated isn't much fun. I don't think it's much fun normally, but I'm not a cat, so I don't get to judge. But you may find like that their chest and their front legs are nicely groomed, but you can see like a ring around their body where they can't reach easily, and that they're just letting the back end go. You might notice that they have poop or urine stuck to the area around their rear end because they can't get back there to clean. And that can make them more prone to urinary tract infections. If they're grooming lazily and they groom from their butt to the entrance of their urethra, they can give themselves a urinary tract infection. So we want to make sure that they're able to stay clean, and cats want to be clean. So if they're not clean and neat and tidy, there's a reason, and we should look into it. Brushing can help, but sometimes people will say, oh, she used to love to be brushed, but she doesn't love to be brushed anymore. That's a big red flag that she doesn't like being brushed because it hurts. And I've had so many cats that it's been so great that we put them on, medication and supplements for arthritis, and then suddenly they enjoy being brushed again because it's not hurting them all the time. And we don't want anything that's going to break the bond between you and your kitty. If brushing was something that you both enjoyed and now you can't do it anymore, we don't want that. We want you to be able to do most of the things that your kitty could normally do. And no, they're not going to be able to run all over the house like a crazy cat when they're 17 as opposed to when they're 2. But they shouldn't just be curled up in the corner like a little dried up prune, not doing anything because they're so uncomfortable. Also, if your cat is walking or you pick them up and you hear crackly sounds, that can be called, that's something that's called crepitus. And that's a sound that arthritic joints make, that kind of crackly poppy sound that you can hear in your own joints if you have arthritis. So that's something to watch. If you pick them up and something cracks, you definitely want to get your vet to check that out. Okay, next question. Should I help my kitty with jumping? Yes and no. So I love aids for jumping, so ramps, steps. If you know that they like to jump on the counter, but they can't quite make that jump, but they jump to a chair easily. If you can put a chair or a stool or something where they can, where they normally like to jump, or let's say you feed them on the counter, and you have to move something so that they can go, start feeding them by the bar so that they can jump on the bar stool and then on the counter. Start to do that. Carol says she kept the ramp industry in business when Hobbs got arthritis. Yes, you had quite the ramp bonanza going on at your house. But yes, so ramps, assistance, even just ottomans well placed. A lot of people have like an ottoman at the foot of their bed or a bench at the foot of their bed. So maybe adjust that so that your kitty can get up onto it and find their way onto the bed. There's lots of things that you can do. Also making sure that they don't have to jump up to get to their food and water, because kitties will get dehydrated. I know it's convenient to keep those things out of the reach of your dogs that have to stay on the floor. But if your cat can't easily get up there, they could lose weight, they could become dehydrated. If they have kidney disease, it's very important that they have free access to water. Also litter box problems. So that's one of the things too. If your cat is suddenly urinating and having bowel movements outside the box, that can be a sign that they're having arthritis and that it hurts to crouch. If you've ever seen the positions cats get into when they have to go to the bathroom, if you're hurting, that is not a good position. And hips can often be affected and they have to squat and move in these odd positions. Also, if you have a ton of litter in the box and their feet sink into it, that can be very unpleasant for a kitty that doesn't have great balance. So sometimes you need, as they get older, to actually cut the litter back so that it's just a thin layer so that they have solid ground under their feet. You can also get litter boxes that are low. Now, I know sometimes kitties will pee over the edge. I like getting like a big Tupperware storage box from the local big box hardware store and cutting a hole in it that's low enough that they can get in. And I also, you know what, Cheyenne, we have a video of the little the steps and the step in the litter box. So what I did for my kitties, we'll post this, and it's one of our tips of the week. I have my big litter boxes, and we put one of those sets of steps up to the box, and then I put a tiny step stool in one half of the box so that they can, because you can do steps to get in, but then if they have to jump out again, they're jumping on that soft litter and it's uncomfortable. So if you put a little step stool, I found mine at Five Below. So anybody who's local here, I don't know where Five Below is, if it's all over the States or if it's a Florida thing. But I found these little step stools and they're in that video. So Cheyenne says she'll find it and share it as soon as possible. And we'll do that, because that made a big difference for my 18-year-old kitty Bailey, when we still had her, that she could get into the litter box. So yes, definitely help. Be careful about helping them jump up, because remember, if you walk away, they still have to get down. And when they get down, I want you to think about, like, if you were diving into a swimming pool, but it was solid, think about how hard their feet have to hit the ground, especially if they're overweight. How hard that is. And you can sometimes see it too, that they will stand on a table and then walk their front legs down the rung or down the leg of the table to get to the ground rather than just jumping. So that anything that where they're being creative and making it so that their jumping is easier, that's a sign that they're having trouble. So all of those things are super important. And while I'm here, and before I forget, weight loss is one of the most important things for control of arthritis pain. So kitties that are, you know, that are 20 pounds and they should be 10, they're basically carrying another cat on their back. And so if you had to carry another person on your back while you were walking around, that's painful. And so, you know, reduction of food, more exercise, although as they're painful, we have to make sure that we're treating the pain before we ask them to exercise. I like canned food for weight loss in kitties. If your cat is on insulin, do not change their food without talking to your veterinarian. If your cat is on a prescription diet, do not change foods without talking to your veterinarian. But I like canned food, a high protein, low carb. For kitties, also meal feeding. If you do dry food, don't let them just eat as much as they want, because as they get older, you know, just like us, we want a snack, but you know, we tend to eat more than our daily allotment of calories, especially if we sleep all day. So we want to make sure that we're monitoring that and taking the weight off. Certainly, if your cat is slim and trim and your vet is not saying anything about their weight, ask and make sure. There are all kinds of body condition scores that you can look at, but basically you should be able to feel your kitty's ribs without pushing really hard through a layer of fat. You know, you want it to feel like, you know, just your knuckles when they're straight out. You don't want it to feel like this with your knuckles up, because that's a sign that they've lost muscle. But you should have to, you know, you should have to feel a little bit to feel their spine or their ribs. And when you look at them from the side, hopefully they have a little up rising before their rear legs instead of their belly being perfectly rectangular. It is normal for them to have that kind of waddle of fur and fat at their belly line. But certainly if your cat's a chunky boy or a chunky girl, losing weight will be a big help in managing arthritis. I mean, it can add years to their life. So please get with your vet to set up a program so that your kitty can be more comfortable. We don't want them carrying around lots of extra weight. Okay, next question. Are arthritis medicines going to make my cat get kidney failure? This is such a great question, because cats are special. They don't process drugs like people and dogs do. They have certain enzymes that they're missing and certain pathways in their body that just don't work. That's why things like Tylenol are so deadly toxic to them, because they don't process those drugs. So when we start giving our medicines, I mean, it's so sad. I have seen several cats that have had to be euthanized because their owners gave them their pain medicine. And the dose was either a drug that was safe for cats, but the dose was just ridiculous, or it was a drug that like Tylenol that's deadly for cats. And, you know, and then they were trying to do the right thing and trying to help their cat. But it's really important that you have a veterinarian overseeing this, and that you're not giving a whole bunch of stuff, you know, over the counter off Amazon that you think might be good for your cat, because there's a lot of danger there with kitties. They're very sensitive to toxins. So the drug that has been most talked about with kidney failure in cats, as far as pain medicine, is non-steroidal anti-inflammatories. And so that's things for us like Advil and Aleve. There are NSAIDs that are safe for cats, but they have to be given at particular doses, and you have to be careful. And it's really important to monitor their kidney values and their liver values, and make sure that they're not having internal bleeding, that you know, the same things that happen with humans. When we give chronic medicines to cats, we need to make sure that we're not hurting them with it. But the studies have been showing that kitties on chronic NSAIDs actually do better. So kitties that actually already have kidney disease, in a lot of cases, will do better with NSAIDs on board, because they get up more often to go eat and drink and keep themselves hydrated and healthy. So we need to be super cautious, but it's something that I am just seeing. You know, I try to put all of my feline patients that are having arthritis on NSAIDs or steroids, like prednisone, if they have another issue that requires steroid treatment, to try to help them maintain and get through their day. And we use the least amount that gives us the good result we want with as few side effects as possible. So yes, there are meds that can make your kitty go into failure. You need to be really careful, but properly prescribed and administered NSAIDs are very safe in cats and are a great idea to help them with arthritis. So it's something that you should talk to your vet about. There are vets out there who are very afraid of those drugs and don't want to give them. And so it's just something that you want to talk about and see if that's a good idea for your kitty. So that's it with that. The other drugs really, we don't have too many that we're using that are directly affecting the kidneys. Kidneys, liver, and GI tract are the things that NSAIDs can affect. So certainly if you start on those drugs and your kitty's vomiting or having diarrhea or not wanting to eat as well, those are things we need to look into. And sometimes we just need a different drug or a different dosage, or go out to every other day. There are things that we can do if your kitty is sensitive to those kinds of things. Okay, next question. I don't want my cat to be groggy on pain medicine. What should I do? This is a great question. So there are meds out there that can make kitties groggy or have other side effects. The good news is that a lot of these drugs, if you can get over the initial grogginess, they get used to it just like we do, and they do fine. So medications like gabapentin, what I like to do is start low and slow with these guys. So I'll give them just like a sprinkle and then work my way up to their normal dose. Sometimes we can give a lower dose 3 times a day, or a higher dose at night and a lower dose in the daytime. And some people are like, look, my pet's really painful. I don't care if they're groggy. I just want to give them a break. In which case, generally speaking, within 2 weeks, they are doing better and getting used to that medication. And if they're not, then we can adjust the dose. So, I mean, some of these medicines have a huge dose range. And so we can adjust it. And what I usually do is kind of work up to the point where they're feeling sleepy, and then I'll back it down. And then we see how they do for a couple of weeks. And then we'll try to increase it again if they're still having arthritis symptoms. Things like gabapentin are adjunctive drugs. They do help with pain, and in studies we've shown that they do help with pain and activity. But a lot of them, it's better to use multiple drugs. And I know cats are difficult, but it can be better to use multiple drugs at lower doses than to try to just make one drug do everything. So I like to use the minimum amount that's going to make them feel better. Something else that can help, there's a joint supplement called, I say joint supplement, that's the wrong thing to call it, but it's actually the only FDA approved drug for treating arthritis directly at the joint. And so what it is called Adequan. And this is an injectable joint treatment that is done, it varies. I do it once a week for 6 weeks, and then once a month. And if once a month is too far out and they're starting to have symptoms, we'll do it every 2 weeks. A lot of cats accept injections way better than they'll accept pills or things in their food. So it's certainly worth a try, and it's something that either your veterinarian's office can do for you, or you can have a certified vet tech who's a pet sitter who wants to do treatments come over to the house and do for you, or we can teach you to do it yourself. I have several patients that are on Adequan, either injected by me or by their owners, and we use that as part of the treatment. I do find kitties that are just starting to be painful, sometimes Adequan just gets them back to where they were before, and they're jumping and doing great, and we'll just kind of watch that until they start having hesitations and issues, and then we'll add things on. So I really like that particular medication for kitties. There are other joint supplements that can go in food, Cosequin, Dasequin, Glycoflex. There are several. The problem is we don't really have great studies on those things. Most of the things that we have are done by the companies themselves, which, you know, studies can be expensive, and most companies have to pay for them themselves. And supplements don't have to go through FDA approval, which is very rigorous. They require that you document everything. I've been involved in studies, and it is crazy what companies have to go through to get a drug approved. So when you have something that's a nutraceutical or just a supplement, it doesn't even have to be what it says on the box. You know, there are reputable companies that really do a great job, but you have to be really careful, because these things, they'll say, oh, this cures arthritis, and they don't have anything to back that up. So I like using the veterinary products that I'm familiar with. Like I said, Cosequin, Dasequin, Glycoflex. If they seem to help your kitty, that's great. Fatty acids are the same way. Sometimes those seem to help, but we want to stick with science and make sure that we're doing the right thing by our patients. So I feel like the FDA approved drugs, they have to prove that what they're doing actually works, as opposed to supplements where, you know, they run a study in-house, and, you know, they give it to a bunch of animals, and they're like, everybody said their pets did better. That's not quite how that needs to go. And some companies are far more rigorous than others. So I'm always willing to try joint supplements. But for me, the using Adequan has really been a game changer, and I find that it's much more dramatic in improving patients. It is expensive, but for kitties, it's kind of nice because they're small, so they don't take as much, so it makes it a little more cost effective. So yes, so those are the things. Also, things like buprenorphine, which is a controlled drug that you can get. That we use a lot for pain in kitties. It's similar to like a morphine type drug. And we use that for chronic pain in kitties, and they tolerate it really well, and it doesn't tend to make them super groggy. It can make them a little weird sometimes, especially the injectable formulation that lasts a little bit longer. But these are things that can help. It can cause constipation, just like opiates in people. And so again, I try to use the least amount that we need. That's a drug that sometimes I'll keep on hand for like rainy days, or if they fall and hurt themselves, that we can get over that acute on chronic pain, as we call it, to help them through. So if you don't want your pet to be groggy, start low and slow and work your way up with pain medicines, or try it. And, cats sleep like 23 hours out of the day sometimes. So if they're wobbly when they walk and, they're feeling good and they're not going to drown in their water dish or fall in the pool or fall down the stairs, then I would say maybe try to push through it. And as long as they can eat and drink and use the litter box without a problem, let them kind of get used to it and see how they do. I did have a client tell me once that they would rather their pet be painful than groggy, and that just broke my heart. Like, dude, if you are so painful that you need to take a medicine that makes you sleep, then I would say I would rather be sleepy, not permanently, but for a little while, if I had to, it would be okay. So don't make your pet suffer pain because you don't want them to be groggy. There are answers that don't cause grogginess, and there are things that we can do to adjust dosages to make that more comfortable. Okay, Cheyenne, next question. What about CBD for cats? So we hear this a lot. And as a veterinarian, technically, I'm not allowed to give you advice about CBD. As a group, veterinarians are like the only people in the world who aren't allowed to give you advice about CBD, just because of the laws and the way that things are working. Hopefully that will change soon. We don't have as many studies in CBD in cats as we do in dogs. So I definitely do not use it as a primary pain control for cats, because it's, if they're really mild, it might help. And finding a reputable company, there's a lot that needs to go into that. And again, I'd say consult with your veterinarian. There are cannabis counselors that you can talk to that are certified to discuss CBD and that kind of thing, and those people can also be very helpful. But I definitely would not let it be the only thing that you use if you know for sure that your cat has arthritis and they're struggling and having trouble. There's something called the placebo effect. So when we give something to our pets to try to make them better, we really want it to work, and it can actually affect and make us biased as to whether it actually works. And that's why studies are so important, to make sure that we're not just hopefully wishing that something would make our pets better. And as a veterinarian, I'm not immune. I've had things that I thought worked really well with my patients, and years later they'd have studies and show that it doesn't really work at all, that we were just wishful thinking. And cats, one of the things that's really kind of cool and kind of annoying about cats is that interaction with their owners, any kind of enrichment, does improve their lives. So, there are cats that suffer from urinary tract disease. They have shown that having extra petting and attention actually reduces their symptoms, because being enriched, if you give them lots of toys to play with, or, they have something new to investigate, a new box, actually boredom is one of the things that can make pain worse. So if distraction can really help. So like when we do spays and neuters in the clinic, if we give a puppy a Kong with peanut butter after surgery to chew on, they will exhibit less signs of pain because they're distracted. And if you think about it, it makes perfect sense. If you're laying in your bed at night staring at the ceiling and you're painful, that's way different than being painful while trying to work. And I've done both. I've worked with chronic pain, and I'm always less painful at work because my brain has other things to do than think about how lousy I feel. So we want to make sure that we're using things that are good and that are safe. And some of these, CBD has exploded, and there is stuff out there. It could be sawdust and olive oil, or it could be toxic. We don't know. So we want to use reputable companies who have a certificate of analysis, who are making sure that things aren't contaminated with pesticides and heavy metals and all of these things. And we're trying to figure it out as veterinarians, because you can buy CBD on Amazon and we have no idea what's in that stuff. So please, please don't just go out and say, oh, my pet's painful and CBD cures everything, because it doesn't. It's very promising and there's lots of evidence coming out. But we need to make sure that what we're doing isn't actually hurting them. So please be careful with that, and please be careful where you get your products from. Just because it's a pretty package, or they say that, you know, it's been proven clinically, they love to say that, and then there's nothing behind it. You know, it's like, oh yeah, we did our own study and, you know, we say it works, but you know, it needs to be consistent in every batch. There's a lot that goes into making these products. So please just be super cautious with that. Is that our last question, Cheyenne? I'm having a memory that it is. Nothing else is coming up. It is. Okay. So, and the reason that we're doing this, and I forgot to mention it at the beginning because I'm kind of frazzled, is that, and Cheyenne, you're going to have to remind me now because I can't remember. Are we National Cat Day today? Yes, thank you. Cheyenne always has it ready so that when I forget stuff, it's there. So happy National Cat Day, everyone. We want our feline friends to be happy, and they really do get kind of the short end of the stick. You know, most of the research and stuff is done in dogs, and those of us who really, really love cats, you know, we watch and we try to use things that are meant for dogs and see if we can get away with it in cats. And there's, you know, there's not a huge number of approved drugs to use in cats. And so we're trying to change that and make life better for our feline friends. So hopefully we will. Erica says it's the best day. Yeah, for our cat lovers, it sure is. And so from me here, and Pirate, the Meow Crow manager, the last of my kitties, we want to wish you all a very happy National Cat Day. If we can help you with your kitties at all, if you have concerns or questions, we do virtual quality of life examinations. So we get on Zoom with you and talk to you about your cat's quality of life. We can't give advice, you know, like medical advice, and we can't prescribe until we've actually met your kitty in person. But we can talk you through what things might be going on and what things to ask your vet about. So if that's something that you're interested in, please visit our website. You can go to helpinghandspethospice.com or hhphospice.com if you're lazy like I am and you don't like to type so much. But we wish you a very happy National Cat Day, and we hope your feline friends are healthy and happy. And if they're not, please let us or let your veterinarian know, so that you can enjoy them for years to come. Thanks, everyone. It was great to see you tonight, and thanks for signing in. We appreciate it.